Imagine an Olympic trampolinist, right? She's at the absolute peak of human fitness. She's suspended high in the air, executing this flawless routine, just preparing to stick a perfect landing.
Oh, yeah, the kind of athleticism most of us can't even fathom.
Exactly. We naturally assume her body is this, optimized, bulletproof machine. But consider this. There is up to an 80% chance she is dealing with a hidden structural muscle failure in that exact moment.
80%. That is just a wild statistic when you really think about
It's
it.
mind-blowing. And to keep it hidden, she may have intentionally dehydrated herself before the competition. So she's actively sabotaging her own cardiovascular performance just to avoid an embarrassing leak on camera.
Right, which completely shatters our whole perception of elite sports, doesn't it? I mean, we look at these individuals as the ultimate picture of biomechanical efficiency,
Right.
but they are quietly being sidelined by this highly specific mechanical overload that most people, and honestly most coaches, don't even realize is happening.
Yeah, and that is exactly why we are here. Welcome to the deep dive. Today, our mission is to unpack this massive, silent epidemic in female sports. We're looking closely at how stress urinary incontinence, or SUI, is fundamentally dictating athletic performance, and in a lot of cases, driving women out of sports entirely.
It's a huge
Sure.
issue. And to figure out how peak physical conditioning can even coexist with this kind of mechanical failure, we are pulling data from a pretty wide range of sources today.
Right. We've got everything from clinical pad weight tests to cross-sectional surveys of actual Olympians and detailed clinical trials on pelvic floor physical therapy. So we've got a lot of ground to cover for you today.
We really do. And the clinical data gives us this fascinating look under the hood. So at its core, stress urinary incontinence SUI is the involuntary loss of urine caused by a sudden sharp increase in intra-abdominal pressure.
Okay, so let's break that down. What does that actually mean in everyday terms?
We'll think about the physical mechanics of, running, jumping, lifting heavy weights, or honestly, even just sneezing or coughing. When you exert yourself that way, the pressure inside your abdominal cavity spikes dramatically.
Right, it's like a sudden squeeze on the whole system.
Exactly. And normally, the pelvic floor muscles act as this support system for the bladder, the uterus, the rectum. They counteract that downward pressure to basically keep the urethra sealed shut.
Let's visualize this with a little physics analogy to make it easier to picture. Imagine the pelvic floor as this small, tightly woven internal trampoline, right? Its whole job is to catch and support your internal organs.
I like that analogy. It's a very dynamic system.
Yeah, so every time an athlete lands a jump or, I don't know, braces for a heavy deadlift, it is like dropping a bowling ball directly onto that internal trampoline.
Hmm.
That bowling ball represents that massive spike in intra-abdominal pressure.
And the springs of that trampoline, which are the pelvic floor muscles, they have to instantly recoil and hold tight against that downward force.
Right, they have to brace for impact.
But if the downward force of the bowling ball is stronger than the upward recoil of the springs, the trampoline sags, the seal on the urethra breaks, and leakage occurs. The load just, well, it simply exceeds the tissue's capacity to function in that split second.
Which sets up this major biological paradox that sports medicine researchers have been debating for a while now. Because on one hand, you could hypothesize that extreme physical activity should naturally strengthen those internal trampoline springs, right?
Yeah, you'd think so, just like a heavy workout strengthens your glutes or your shoulders.
Exactly. But on the other hand, you could argue that dropping heavy bowling balls on a trampoline for 4 hours a day eventually stretches the springs out, overloads the tissue, and just weakens the whole system over time.
And the data we're looking at today strongly indicates that the second scenario is what's actually playing out in the elite sports world. The constant extreme overloading is outpacing the tissue's natural ability to adapt without, targeted intervention.
And what makes this finding so compelling is who it is happening to. I mean, when the general public hears the phrase urinary incontinence, they almost universally picture a woman who has gone through multiple childbirths or someone who is postmenopausal.
Oh, absolutely.
Mhm.
Because pregnancy and aging naturally change the elasticity and the strength of those muscles.
Yeah.
But the demographics in these sports studies completely flip that assumption on its head.
Right, because the highest rates of this mechanical failure are frequently occurring in what the medical field calls nulliparous women. Nulliparous simply meaning women who have never given birth.
We are talking about highly fit, nulliparous athletes with an average age of 20.
Average age of 20, that's just wild to me.
I know, it's crazy. These are young women at the absolute peak of their physical development, experiencing a structural failure of the pelvic floor purely because of the extreme mechanical demands they're placing on their bodies.
So if this is primarily an issue of mechanical overload, dropping too many bowling balls on the internal trampoline, we naturally have to look at which sports are doing the most dropping.
Right, we have to look at the impact levels.
Exactly. So when you look at the broad meta-analyses of female athletes, the overall prevalence of urinary incontinence sits at about 25.9%, with 20.7% specifically being stress urinary incontinence.
Which is already a huge chunk of athletes.
It is. But when you break those numbers down sport by sport, the disparities are massive and they map perfectly to impact levels, just like you'd expect.
Yeah, so on the low impact end of the spectrum, you have sports like golf and swimming, where the prevalence rate is near 0%.
Because there's no bowling ball, right?
Exactly.
Yeah.
The biomechanics of a golf swing or a freestyle stroke, they rely on gliding motions and rotational torque rather than a sudden explosive downward pressure. There is no heavy impact on the pelvic floor. But in high-risk sports, the numbers just skyrocket.
Like volleyball, right? I saw the prevalence there is 75.6%.
Yes. Think about the mechanics of a volleyball spike. A player leaps into the air, violently contracts her core to swing her arm, and then absorbs the shock of landing on a hard wooden floor.
That is a massive compound spike in intra-abdominal pressure.
It really is. And trampolining tops the entire list, reaching up to 80% prevalence. Gymnastics, track and field, cheerleading, and heavy resistance training like Olympic weightlifting or CrossFit, they're all grouped right at the very top of the risk categories.
The forces generated in these sports are just astronomical compared to everyday human movement. But I have to ask the question that naturally comes up when you hear all this.
Go for it.
If an athlete is jumping on a trampoline for hours a day or doing like 1,000 box jumps in CrossFit, shouldn't their pelvic floor muscles naturally adapt to the load? I mean, if I do 1,000,000 calf raises, my calves get incredibly strong. Why doesn't the repetitive use of jumping just naturally build a rock-solid pelvic floor?
It's a great question, and it really comes down to the principles of motor control and muscle specificity. Basically, you get better at exactly what you practice.
Okay, makes sense.
Right. Athletes spend thousands of hours honing conscious, highly specific athletic skills. But the pelvic floor is a distinct muscle group that requires targeted activation. Regular athletic movements do not automatically recruit the pelvic floor muscles to their maximum capacity.
Oh, wow. So you can have incredibly strong quads and a weak pelvic floor because the brain just isn't sending the signal to fully contract those specific internal muscles during the squat or the jump?
Exactly. The athlete is performing the movement, but the pelvic floor isn't getting the memo to brace for impact. Now, biomechanically, elite athletes actually do develop stronger pelvic floors than non-athletes, just to maintain a baseline level of continence.
Right, because a regular person's pelvic floor couldn't handle a single elite gymnastics tumbling pass without failing.
Exactly. It would just give out. But because the athlete's pelvic muscles aren't being consciously and specifically trained to match the extreme superhuman intra-abdominal pressure they're generating, the system still falls short.
And impact isn't just about explosive jumping either, because the observational data highlights that while jumping produces a massive acute spike in pressure, long-distance running is also incredibly damaging to the pelvic floor. But it happens through a completely different mechanism, right?
Yes. Running is an issue of fatigue. So a single footfall during a run produces a much lower peak pressure than, say, a dismount from a balance beam.
Sure, it's a smaller bowling ball.
Right, a much smaller bowling ball. But a marathon runner might experience 30,000 footfalls over the course of a race. The duration of that repetitive impact simply exhausts the pelvic diaphragm.
It just wears it out.
Yeah, the muscle fibers fatigue, they lose their contractile strength, and eventually they just stop firing effectively.
Which brings us to the core focus of our deep dive today. When a 20-year-old runner realizes her pelvic floor is fatiguing and giving out at mile 10, or, a gymnast knows a certain tumbling pass is going to cause a leak, how are they actually handling that during a competition?
The behavioral alterations are severe, and honestly, it's heartbreaking to read in the research. These athletes go to incredible lengths to silently manage the issue.
Yeah, the lengths they go to are just crazy. They wear dark clothing, specifically black leggings, so leaks aren't visible. They use absorbent pads or panty liners during high-level competition, which, as the studies note, can cause pretty bad chafing and discomfort.
And more critically, they start altering their actual biomechanics to avoid the leaks. An athlete might subtly avoid jumping as high, or they might skip double unders in a workout, or intentionally reduce her overall training intensity just to prevent an accident.
But if a gymnast alters her landing mechanics to protect her pelvic floor, she loses points for form. If a CrossFit athlete hesitates on a heavy squat, she loses the heat. They are no longer competing at their peak because they are mentally and physically guarding against this mechanical failure.
Exactly. They are constantly holding back. But the most extreme coping mechanism found in the research, and this is where it really impacts overall performance and health, is fluid restriction.
Yes, this part blew my mind. Pre-exercise hypohydration. Athletes intentionally depriving themselves of water before and during competitions to ensure their bladders are completely empty.
They are willingly dehydrating themselves to avoid an embarrassing leak on the field.
Let's really break down the physiology of why that is so detrimental to an athlete. When you intentionally dehydrate your body, your blood plasma volume drops, right?
Right, your blood literally becomes thicker, like syrup.
And so to deliver the same amount of oxygen to your working muscles, your heart has to pump much faster, working overtime just to push that thick blood around.
The cardiovascular strain is immense. The systematic reviews in our sources clearly demonstrate that hypohydration significantly impairs aerobic exercise performance. It just crushes an athlete's peak oxygen consumption, their VO2 max, and it lowers their oxygen consumption at the lactate threshold.
So they're just completely gassing out faster.
Exactly. The muscles fatigue faster, core body temperature rises more quickly, and even cognitive reaction times slow down.
You are literally draining the fuel and coolant from your race car so that it doesn't drip on the driveway, and then wondering why the engine seizes up mid-race.
That is a perfect way to describe it.
Yeah.
They are trading their cardiovascular health and peak performance for temporary bladder control.
And the performance impact extends far beyond a single lost race or a bad workout. The dropout statistics reveal a major public health concern here. Because this condition is so bothersome and so difficult to manage silently, 20% of women abandon sports altogether because of urinary incontinence.
That's 1 in 5 women. And furthermore, 10.4% abandon their absolute favorite sport.
1 in 5 women completely walking away from athletics. I mean, for you listening, think about how massive a barrier that is to lifelong physical activity. Quitting exercise in your 20s because of a treatable mechanical issue sets off this terrible domino effect.
Oh, absolutely. Because inactivity dramatically increases the risk for a whole host of chronic diseases later in life. Hypertension, type 2 diabetes, cardiovascular disease.
The ripple effect is just profound. SUI itself is not a life-threatening condition, but the sedentary lifestyle it often forces these women into certainly can be.
It's a tragic irony, really.
So if we have a condition affecting up to 80% of athletes in certain sports, destroying their VO2 max through dehydration, and forcing 1 in 5 women to quit sports entirely, how is this not the primary focus of every sports medicine clinic in the world?
That is the million-dollar question. And we really have to look at the psychological findings in the research to understand the culture of silence around this.
Right, because it really is a culture of silence.
The research points heavily to normalization. In surveys of female athletes, particularly in strength and high-impact sports, a huge majority believe that experiencing SUI was simply a normal consequence of their sport.
They view it as an inevitable biological tax they have to pay to participate?
Exactly. They accept it as the cost of doing business. And because society attaches such an immense stigma to incontinence in general, they don't dare speak about it. The studies noted that most athletes never discuss their condition with teammates, coaches, or even their primary care doctors.
That silence leads to this glaring blind spot in standard strength and conditioning. I mean, consider an Olympic-level athlete. They have a registered dietitian monitoring their macros, a sleep specialist optimizing their circadian rhythm, and a biomechanics coach analyzing the exact angle of their knee during a sprint.
Every major and minor muscle group is tested, tweaked, and optimized.
Yet the pelvic floor is treated like a ghost muscle. It is completely ignored in routine athletic programming. But this is where the clinical trials in our sources offer incredibly clear, actionable solutions. Because this isn't a permanent structural failure, is it?
Not at all. The grade A recommended highly effective first-line treatment is pelvic floor muscle training. And I want to be clear, this is far beyond the generic advice to just, do Kegels that you might read in a magazine.
Right. This is actual sports physical therapy.
Exactly. This involves targeted, specialized physical therapy to rebuild the motor control and the sheer strength of those internal trampoline springs.
And the data shows it works. When women in the general population undergo dedicated pelvic floor muscle training, the cure rates are exceptionally high, sitting between 44 and 69%. And the clinical definition of a cure in these trials is incredibly rigorous, which I found fascinating.
Yeah, researchers don't just rely on patients saying, oh, I feel better. They use a highly controlled pad weight test.
Right, so how does that test actually work?
Well, an absorbent pad is weighed down to the exact gram. The patient then undergoes intense physical exertion, and the pad is weighed again afterward. A clinical cure is defined as having less than 2 grams of leakage during that extreme exertion.
2 grams? That's almost nothing.
It is a functional, measurable return to normal continence.
We are talking about practically eliminating the issue through physical therapy. And the studies note that while elite athletes usually aren't aware this specific physical therapy even exists, they are highly motivated to try it once they learn about it.
Of course they are. If you tell an athlete that there's a muscle group they can train to stop a performance-ruining issue, they are eager to incorporate it into their routines. They're already doing hours of conditioning anyway.
Exactly. And beyond physical therapy, there are also immediate mechanical interventions they can use, right?
Yes, for moments of extreme, unavoidable impact. Like a gymnast executing a high-velocity dismount, devices such as vaginal tampons and sterilized pessaries can actually provide physical structural support.
So they act as a sort of mechanical backstop.
Exactly. They apply pressure against the urethra to prevent it from being pushed open during that split second of peak intra-abdominal pressure.
So athletes do not have to rely on dehydration or quitting their sport. There are proven therapeutic and mechanical tools available right now. It completely reframes the whole narrative. Stress urinary incontinence is incredibly common in the athletic world, but the research proves it is absolutely not a mandatory requirement for being a female athlete. The sports medicine community simply needs to break the silence, assess the pelvic floor just like they would a hamstring or a rotator cuff, and integrate the targeted training.
Let's bring this all together for everyone listening. We started with the paradox of peak athletic conditioning coexisting with a specific mechanical failure. SUI happens when the heavy bowling balls of intra-abdominal pressure drop onto a pelvic floor trampoline that hasn't been specifically trained to handle the load.
Right, and it disproportionately impacts athletes in high-impact sports like volleyball and trampolining, or high-duration impact sports like marathon running.
It actively sabotages athletic performance by pushing women to dehydrate themselves and alter their biomechanics, and it literally drives 1 in 5 women out of sports entirely. Yet, beneath the stigma and the normalization, it is a highly treatable mechanical issue that responds beautifully to targeted physical therapy. Knowledge truly is power in this scenario. Understanding the physiology removes the embarrassment. It's really just another muscle group that requires specific loading and motor control training to match the demands of the sport.
Whether you are an Olympian preparing for a gold medal routine or you are just getting into CrossFit or marathon running, understanding how to actively engage your pelvic floor is just as vital to your longevity in the sport as protecting your knees or stretching your hamstrings.
We shouldn't let repetitive stress break down the system without at least checking if we can upgrade our own biomechanics first.
Absolutely. And I want to leave you with a thought to mull over as you go about the rest of your day. We just explored how world-class athletes are silently enduring and quitting the sports they love over a highly treatable condition simply because society deemed it embarrassing or told them it was normal. It makes you wonder, what other everyday physical discomforts or limitations in our own fitness routines have we just been conditioned to accept when a simple, highly effective solution is hiding right in plain sight?
It's definitely something to think about next time you hit the gym.
Thanks for diving deep with us today. Keep asking questions, keep challenging what is considered normal, and we'll see you next time.